Hello, this is Catalyst with the Katalyst Channel, and I'm here to welcome my good friend Grace, who is here to share something that's very near and dear to her that she just loves doing for other people and providing for other people. So tell us more, Grace, about that.
Oh, thank you, Kate, for inviting me for this, like your channel and talking about my passion. I have a good opportunity. You are providing me with explaining it how the Medicare works for people. Medicare is one of the most important people, who are most important for people who are looking forward to retire. They need to know about this even before their retirement so that they can plan well their retirement. So I'm very passionate about educating people how they have to enroll from the Social Security and get a card for the Medicare A and B, and also how they can enroll in Advantage plans and Supplemental plans, and how they know what is the importance and what's the difference between the two, and also helping people who are qualified for Medicaid and their qualifications. Also, I like to help people, to get into those kind of benefits the government is providing for meeting their healthcare needs. Also, I know I'm also a healthcare professional. So in the healthcare for many years, almost 29 years, I'm very working very close to the healthcare, and as a passionate nurse helping people, that passion I extended little forward and become a Medicare advisor as well. So this is my second job, but this is also I am keeping as a passion, and I feel very satisfied. Helping people about their difficulties. Nurses help people when they are in difficult times, their most difficult times, and also the insurance, especially the health insurance, Medicare, all these are very important, and people are the most important cost, especially when you are retired, is your health care and long-term care. These are the things we are providing education and helping you to have finding better plans and how you can meet your cost.
I love that you shared all of that because I know nothing about any of that. Now, I don't know if other people are running around like a little Medicaid thesaurus or encyclopedia or a Wikipedia page and who has friends that are in the biz. But
Yeah.
I hear things like you had so I'm going to throw out a couple of things to kind of spring off of. And one of the things that we decided right on the spot was we wanted to do this together, almost as a public service informational type of thing for people as they are getting to the age of applying for Medicaid. And you had said something that really perked me up, which was you need to do it before the age of what?
65, at the age of 65, they have to enroll in Medicare.
And if
So,
they don't, then there was something that you mentioned. What was that?
yeah, if they don't enroll, they may have to, especially, the Medicare A, there is two parts for Medicare. Medicare A and Medicare B.
Yes.
Medicare A is the hospital coverage insurance. Hospital and skilled nursing facilities, those kind of, areas are covered by Medicare. That
Okay.
everyone is entitled, because if you are having a 10-year, 40 work credit, that means 10 years of work history in the US, you are eligible for Medicare A. Or
Okay.
if your spouse is eligible, I mean, worked more than 10 credits and you are a homemaker, you are eligible.
So when we think of, because I think I might have for myself sorted something out. If we think of Medicare A, we think of a building, like a hospital or a skilled nursing facility.
Yeah.
That. Okay. All right.
Yeah, those services are provided by, covered 80% only is covered by Medicare, any of the service. And
Okay.
people have the Medicare B is The second part that is covering the outpatient and your physician visits, specialist visit, all those kind of things are covered by Medicare. Outpatient procedures, all these are covered by Medicare B. Medicare B has a premium.
Okay.
If currently, 2025, the premium is $184. That is directly taken from your, the Social Security account.
Is that
And
a
yeah,
month or a
a
year?
month,
Okay, 184
a month, yeah.
a month. Okay.
Yeah, that is, like every year they adjust a little bit here and there, you know.
Okay. So B would be covering everything but the hospital and okay, so the hospital and like medications. So
Medications, we have another part.
okay, so
That is
B
D.
okay, so B covers everything. B, what does B cover again? I want to make sure I get this right.
Yeah, B covers the outpatient services and the physician and specialist visits.
Okay, so
Yeah,
B would be covering the physicians and the
specialist
okay.
and the outpatient services, if any outpatient
Okay,
procedure
so
or
the
anything. This
people
also is 80%.
80%. So it covers
Yeah,
80%. So B would be
yeah,
covering 80% of the people who would be caring for you.
yeah,
That makes sense to me. So the
yeah,
first one's the building. A is for the buildings and
yeah.
where you would be staying. And then B would be for the people who would be caring for you, your physician, outpatient, and specialist. And then
D.
is there a C?
C is the advantage plan. That is different. But D we
Yeah.
need for the prescription drug coverage. Drug. D for drug is the
Okay.
drug coverage. Your medications are covered by Medicare D, Part D. And
Okay.
this is also, like you can prescribe as a, I mean, you can subscribe this as a standalone plans or with the Medicare Advantage plan. So C is Medicare Advantage plan.
Okay. So A is for the building you'd be staying in. B is for the people who'll be taking care of you. D is for the drugs
Drugs.
or medications. All right. And then C is an advantage. So you can see advantages.
And you can combine all this plan. You
Okay.
don't have to MAPD plan, Medicare Advantage prescription drug plan covers
Okay.
your most of the costs. Some of them doesn't have any like subscription fee.
Okay.
Just have to enroll, and it could be zero monthly pay. Or
Okay.
some of them, like as low as $20 to $40 per month, you may get. And also, this may give you other benefits like your dental, vision, hearing. Also, is when you enroll in the Advantage plan, and
And
also,
that's C.
yeah, that's a C. And
Okay.
there is also another plan called Supplemental plan,
Okay.
Medigap. That is a good plan that will be taken all over the country, 50 states. If you are traveling more, you have more chronic conditions, then the supplemental plan with the A and B is there, and the supplemental plan will be more helpful because if you are traveling always, visiting your families, children, staying there, and more chronic conditions, that the supplemental plan is much better for you. But that has a subscription 250 to 350 per year. Sorry, per month.
Okay.
Subscription premium is there.
Okay.
Yeah.
So the plan C was how much per month?
Plan C, most of the time nothing. Sometimes it is $20 to $40 per month.
Okay. All
Yeah.
right. And then the supplemental is how much?
Supplemental is 250 to 350, but that is covered all the 20%, which is not covered by the Medicare, is covered by the supplemental plan.
All right.
That is a
So,
good
so the
thing.
20% gap that you
Yeah,
normally
the gap they cover.
okay.
And
Okay.
but
So
still they have to buy a prescription drug plan that may cost 50 to $70 per month with the supplemental plan.
okay. So
Yeah.
okay, so C is like 20 to 50 bucks, possibly, or nothing. And then
Yeah.
supplemental is 20 to 50 bucks or something per
Two,
month.
250 to 350.
250 to 350 a month. So, and then, okay. So I didn't realize that either. I'm thinking that this is a federal program, so I
Mhm.
don't need to worry about coverage going from this place to this place to this place. So I'm thinking from, contiguous United States here that I should be covered because I'm covered under a federal thing.
Yeah.
So I'm kind of glad that I'm thinking to myself, there had to have been people that have been caught in that, like, wait, what? I'm in Virginia, but my family's in Massachusetts, so I went to go visit them and I had some kind of a whatever, and that this isn't being covered now. Is that what you're saying would happen?
Yeah, yeah, but only if they are going for a visit and out of network. In Advantage plans, have there is certain we are planning it according to the zip code
Of
because the
course.
zip code, the service area is limited, to the certain areas each
Providers.
plan providers. They
Yeah.
have to choose.
Right.
That's fine. But in an emergency, if they are going one or two times for the net out of network, it is covered in a
Okay.
higher copay rate.
Okay. So it's not
Yeah,
like they would be just completely
yeah,
abandoned if they had
yeah,
an emergency type
yeah.
situation. But if you had a
Yeah,
chronic situation
yeah.
and you,
Advantage plan is better because
okay.
like you don't know whether sometime from here people if they are in a village and they have to take into the a cancer treatment to MD Anderson or here Moffat, something like from a remote area, then it is out of coverage area for their advantage plan.
Oh, wow.
you know
Okay.
People like us living in Florida, mid Tampa, we have an advantage in case we have most of the specialties available in our area, but all United States people doesn't have that. Some people are living in remote areas.
Okay. Right. Right.
Yeah.
Right. Right. Yeah. Thank you.
Mhm.
Thank you. This is,
So,
I'm learning. I knew none of this. Absolutely
yeah. Yeah,
none.
I didn't know none until I get into this, I didn't know. I also was thinking, oh, after 65, everything is covered by government. I don't have to spend anything for healthcare. That was my perspective too before joining this. So I learned a lot and every day learning a lot. And another thing is the penalty. People, if they are not enrolling, A is given by the government, B we need to enroll through the social security and we have to enroll it. If we don't enroll at the age of 65, then we may have penalty. Like there is a 7 month window for enrolling in Medicare.
Oh,
That
wow.
is your birthday month. If for example, you think you born in August,
Okay.
you have August and also 3 months before that. That is July, June, May, and the 3 month after the birthday month, September, October, November. So that is your born in August. Their window is to enroll in Medicare from May to October.
Okay.
So within that window, they have to enroll. But another exemption is there if they are working. If I am still working and having an insurance through my employer, like some people retire at the age of 67 or 72.
Yeah.
So
Yeah.
they don't have to enroll right away at 65 for Medicare B.
Okay.
Yeah, Medicare A will be there, and that's their primary coverage for any hospitalization at that point. But B, they don't have to because they have an employer coverage is still there. We should have evidence we had this coverage. So then you are not having any penalty, but you are thinking, okay, 67. Now I am retiring. You can enroll in the B plan within the 60 days, 63 days actually. You can enroll in the B without any penalty.
I
And
do.
also the same applies for Medicare Part D also. Yeah.
Okay, so I just quickly pictured a meeting where they were sitting around going, okay, so how many days after they retire should we make it mandatory that they apply for? And then there was like, I don't know, 13 people in the room, and they were like, I don't know, 60 days, 67, 72, no, 63.
Three.
Six,
Yes.
63 is the number. Maybe they had them pull a number out of a hat.
Yeah.
Like, I don't know. Let's just see what comes out
Yeah.
of the hat. 63.
Yeah.
I don't even know.
That's
So,
the time. Otherwise, they have maybe 10% penalty. The penalty will be lifelong. That's the problem.
yes, yes, yes.
Yeah.
You were saying that.
Yeah.
Okay, so I'm going to try this on. We're going to throw out a couple of scenarios. I'm retired. I'm not working right now. I'm getting ready to turn 65 and in August. And so I need to be thinking of that, like, oh, wait, it's May. I almost need to set something on my calendar right now, not to forget, right? Or tell my
Mhm.
friends, hey, you're almost 65. You got to apply because the
Yeah.
building will be covered that you're going to be taken into, but the people who take care of you will not be. And unless you apply for this within this window, right? So
Yes.
from May to say October, I have that window to go ahead and apply without any kind of a penalties for so that I can receive coverage for the people who are going to be covering me would be covered under Plan B. So,
Yeah.
but if I don't do that, then I have a 10% penalty and then could be penalized forever.
Forever. Yeah. Lifelong until you are
Wow.
alive.
So I'm
Yeah.
not wondering what that, I'm wondering
And
how that
yeah.
meeting went, but whatever. Okay. All right.
And unfortunately, this is coming directly from, is taken directly from your social security check. So you are getting the money after taking out the B part.
Okay.
And if it is with the penalty, B and D, if it is with the penalty, that taken away. So you don't have any way to, waive or pay later.
Wow.
People can be, I can put it in my debt. I don't care. We cannot do anything like that because it's in the directly from the social security. It takes out.
So whether or not you get to take advantage of it or not, they deduct it.
Yeah. Yeah.
Wow.
Yep.
All right. Well, no,
So,
this is a great public service like
yep.
announcement for
Mm-hmm.
sure.
Yeah.
Because that like Social Security is pretty fixed, the amount that you're going to get, and then
Yeah.
you would get. And when you say 10%, is that 10% of whatever you
Of the
spend?
premium of 185,
Okay.
the 10% of the 185, whatever, if it is, it is going
Sure.
according to the inflation and everything,
Right.
like every other price is going up, this will be also nominally going up.
Okay, so if it was
Yeah.
today and
Yeah.
I
Today,
and a person forgot, then $18.50 would come out of their check
check.
for whatever that is. I mean, in 10 months, that's $180. That's their whole payment.
Yeah. When
Yeah.
you retire, you know that every penny counts. When you
Oh,
work,
yeah.
you don't care that much because you have income in the stream of your income is coming up and you are healthy and you are able to make another kind of income, anything you can do
Right.
because you are young and healthy and working.
Hmm.
When you are retired and you are aged and tired, every penny counts for your, like your basic needs.
Of course. Of
So,
course. So, and if I was working and now I'm 67 years old,
mhm.
and I go to leave my work, I have 63 days from the time I say bye, have a big retirement party. Bye
Mhm.
everybody, see you later. And then it's like, yay, and then I've got 63 days. So hopefully I don't fall down and, break a leg or something.
Yeah, that 63 days, your other plan would have covered you, like
Right.
maybe. But
Right.
within that time, you have to enroll, otherwise you will be ending up in penalties and yeah. So it is difficult. And if every some, like wealthy people may not care about this penalty or anything, but most of the population is not wealthy. They are
Mm.
living, and also the healthcare is increasing. Healthcare cost is definitely increasing when you go
Right.
older because
Uh-huh.
the needs are higher. So
Yeah.
definitely, it's very important to have it. The Medicare Advantage plans most of the time have a co-insurance out-of-pocket maximum, just little, between 9,000 and 10,000. Most of the plans I have seen is that much out of the pocket annual cost. So that itself is a big money for most of the people, right? When you
Yes.
retire.
And I find
So,
myself thinking like if there's someone very passionate about legislature and this kind of stuff, it'd be okay to sit in on those meetings,
yeah,
see what's going on with that hat they're
yeah.
passing around.
And also, unfortunately, we cannot predict what will happen to our social securities, our
Right.
Medicare. It is, Medicare is instituted in 1969, actually.
Oh, wow.
Before that, we didn't have that Medicare. It was something different would be there, must have there, but like it was not Medicare. It was instituted in 1969, and we don't know and what will happen to any of this. The
Right.
economy, how the economy of the government goes, and government policies can change, and
Right.
like people, older people, the baby boomers, already retired people, and the senior citizens. I mean, most of them, 90% of them had a pension plan, right?
Right,
And
right.
the people, baby boomers now retiring, they don't, many of them doesn't have a pension. 90% doesn't have a pension plan. That change happened because before the private sector had a pension plan.
Yeah.
Now, only the government sector, if you are working for state government, federal government, veterans, or some of the major companies like, in New York and all MTA, the, railroad, those kind of bigger major companies only have the pension still available. Others, we are all living with our 401k. All the, I mean, the currently retired other people live with their 401k aggregates and their social security.
Um, yeah, thank you for
Yeah.
sharing all of that,
Yeah.
and who knows what the future brings, right?
Yeah, the future we cannot predict because things are always evolving according to the needs of the population. Sometimes it is positive changes, sometimes it can adversely affect the people. So we don't know, like but we are always hoping for the best and how we can manage the Medicare at this current point. What is how we can
Yeah, yeah,
use of it, how we can take the advantage and benefits of Medicare
yeah,
and to enroll. These are very important. People think about that when they are ready to retire. Maybe I will say, in my personal opinion, at least by age 63 people need to think more about this and learn more about it. And
yeah,
if somebody they know, they can or approach and learn and try to enroll to compare the plans. And also, even their other retirement plan money, 401k and all, they should create plans how they can increase the growth without putting them in a high risk. I can talk to that about in a different video, maybe in a different section.
yeah.
But
That sounds
I will stress on the Medicare and also the Medicaid. Some few words I can say about that. Medicaid is a state government program, and that is for the low income people.
Oh, okay.
If people are, if they are getting an yeah, monthly income of less than 1,500 individually and 2,000 as a spouse and a family of two, like husband and wife,
Okay.
then they will be qualified for Medicaid. So
Okay.
the Medicaid, then they have to apply to the Social Security, State Social Security Department with all the forms filled and everything.
Right.
And then they get. And some people get a low income subsidy if they are not quite qualifying for Medicaid, but they are still low income. They may get a low income subsidy. Yeah, another good thing happened with the Medicare, the D plan, Medicare drug plan. I
Hmm.
want to share also. Many people, you also may be hearing from, when you are working in the hospitals, you were here, okay, I'm in the donut hall, I'm going into the, that donut hall thing, you were maybe, heard of that, right? Even though we don't know what it is. I didn't know when I was working in the hospital. Okay, some old people are saying, oh, I'm in the donut hall. I cannot afford this medication. They won't cover anymore. That kind of talk I was hearing from them. But now, I mean, after getting into this business, I got the knowledge of what is the donut hole. So when they have that donut hole is taken away because donut hole was when they are like in the certain amount. I think 1,500 at that time because it's not there and it raised. That's why
Okay.
I'm not talking much about that because it's a gone
Okay.
thing. So they will not be covered anymore. They have to pay out of pocket for their medication if they
Oh,
finish that
okay.
certain. But now that last year, actually for 2025, last year they made the legislation, but it is for 2025. They did the $2,000 maximum out of pocket copays for the drugs, whatever drugs,
Oh,
medication
okay.
they take, that is a $2,000 out of pocket only. After that, it should be covered. They cannot, and only thing, brand name covers or another, brand name most of the time doesn't cover even for our insurance. First they prefer the generic medications. But the Medicare needs all the insurance agency companies to have every group of medication, every class of medication, at least some one of them in the
Oh,
in their
nice.
tiers.
As
Yeah,
covered. Okay, so
yeah.
So what you described was before 2025, there was a group of Medicaid recipients, right? Medicaid or
No,
Medicare?
this is Medicare recipients. Yeah.
So there was a group of Medicare recipients who somehow didn't meet requirements and they called themselves they're in the donut hole. So basically, medications and such were not being covered. And but as of 2025, after they've satisfied $2,000 out of pocket, then it's covered, and
Yeah.
and that there is a medication in each and every medication class that can be chosen from specifically to help to cover their needs. Is that what you're saying?
Yeah, that is true. Yeah, they need to, like we cannot say any even the costly medication. It's not covered by insurance. They cannot say some of them may not be every. We still the providers will get a letter, or the patient may get a letter that this medication is not covered. You can choose another generic medication in that class. So
Right.
if there is no generic medication for that particular disease
Yes.
condition, then they have to, include
Cover it.
one of
Okay.
the
Yeah.
brand medication
Yes.
in
Yes.
this. It's a high tier medication, but it's a brand also should be included. So everyone get their treatment much better. This legislation was great for the, the medication coverage.
I love that. I
Yeah,
love that. That's great. So even
yeah,
if it's a brand name, top tier
yeah,
medication, if they do not, if there is not a generic brand of that version of that, then they have to go ahead and cover it. That's great.
yeah.
That
That's a
makes
good thing. Yeah, that's
that
a
makes
great thing happened
yeah, that makes
this year. This year. So sometime, like we can expect great newses, and sometimes little, disappointing newses.
yeah. Yeah, let's take those wins every chance we get.
Yeah, we will, like enjoy the wins, and we have to go through the falls also.
Yes, yes.
Yeah,
So tell me, Grace, we didn't talk too much about it, but I just happened to notice how you lit up when you talked about Medicare and how you help people, educate people, and provide services for them. And it's a passion of yours, and you really enjoy it. It's something you super believe in. And so tell me about that part. So if people say when people want to get a hold of you, or if they have any other questions and that kind of thing, tell me how they can go about getting a hold of you. I can put it in the description as well.
yeah,
But one of the reasons that I felt inclined, of course, I adore you, right?
yeah,
So there's that part of why we're together now. But there was also, like I said, I saw that spark and joy of a person who genuinely wants to be of service to others, sharing something that they're extremely passionate about it. And one of the things that you had shared to me was that people were really appreciating that you were taking the time to explain things to them in a way that they could understand.
yeah,
And then understanding that not everybody is walking around with this lingo and knowledge. I know I wasn't, so I'm coming away from this far more educated than I was before. So thank you for that. But if you could share about yourself and what you would like to do for other people, what you would like to offer.
yeah. Actually, I am, enrolled with currently I am enrolled with four companies. I have Aetna, Wellcare, United Health, and Humana. So if I'm like a captive agent, if some people may call, like if even I get a call, are you are eligible for Medicare? Like, but I'm only 49. Think about that. So that's a random calls people get, and people get more confused, I will say, with that calls.
Okay.
Right. And also if they are a agent of United, they will only offer the United profit, the products. But fortunately, we have multiple companies. Even I can get more companies in my platform. Actually, I'm part of Integrity platform.
Okay.
And but now I am only, like everything together, I cannot take at a time. So that's why I'm trying to, learn more and give more services in a better way. I have four major companies in our area. So we compare each patient, when they contact. You will be sharing my contact information. So people can contact me and I will ask them. We definitely have to sign a scope of appointment 48 hours before, our actual meeting. So people can contact me, then I can send them a scope of appointment. And after 48 hours, they can, like we will set an appointment also the same time after 48 hours. So that way they can then talk to you, talk to me and about how they want. And we ask about their medications, what providers they are using, in the area, which all providers they have, the primary care and PCPs. And
Okay.
we will look at the plans who cover better. We compare with this four plans, at least three plans for each individual. So it's a customized plan, meeting their needs. But, like many times, if they don't want to lose their providers, right?
Yes, they have a
When they are
relationship.
comfortable with their provider,
Yeah.
they want to keep that provider.
Yes.
And then the medications, they need to be covered. So everything is not covered in same kind of way in the same plan. The cost can be different in different, insurance, the out of pocket cost and everything. And the visit charges, the copays can be different. And the premium is there or how much it is, that is different. So we compare all this, their situations, and find a plan that provider takes. So that appointment is there, and then we enroll in that first appointment itself. When we are showing them how, mostly I do the Zoom appointments.
Okay, Zoom. Okay.
Yeah, yeah,
So what you're saying
yep,
is
yeah.
a person would contact you and within 48 hours they would have some kind of an interview or something like that from the time
Mhm.
of
The
being
information, yeah,
so once they fill out the information within 48 hours, you'll have some kind of a appointment to have a discussion with them.
yeah,
And then from there, you would look through who their provider is and all of their medications and care and different kinds of appointments maybe that they're going to. And you would look through, say, Aetna, United Care, and the other two, the four that you're with, and but you have the ability to do add others onto that as well. But those four major companies, you would go ahead and look through and see which one made the most sense to them that kept them in the way that they were already existing in or better. And seeing the best way to cover them in turn, making sure they had all the coverage they needed in the best way possible.
yeah,
So it's basically you are making a custom thing specifically for them. And to me, when you say that, that's the part where, I've had to play around choosing my insurance, and I'm just never doing it online, or I can even call or whatever. Has always been like this. It's almost like closing, like I'm blindfolded, and I've got like a dart, and there's maybe a balloon out there, like at the fair, and I just whichever one I hit is the one I'm gonna get. That looks great.
yeah,
And so yeah.
yeah,
So I'm so glad that there are people like you out there that love doing this because
yeah,
like it's a special kind of suffering for me. I
yeah,
I don't find any joy in what you're doing. So so all right, so that's great. So and then you would help them to choose what's best for them with them.
yeah.
Is that
And
correct?
also, like the open enrollment period is October 7 to
Okay.
December 15. Then that's an annual open enrollment period.
Okay, so open enrollment is
Yeah.
October 7th. So that's coming up like 5 weeks
Yeah.
away.
Mm-hmm.
October 7th to what?
December 15th.
December 15th. Okay. So that's the time, like if a person has been married for the past year with something that they don't, thought it was, um,
Yeah. Right for them, they can
yeah,
come to
that they
us.
went down the
Yeah.
aisle with that one thinking this is the one, but then they got in the
Yeah.
middle of it and said, no, it's not. And so they get out.
Yeah, and they can do that, and also that for the next year coverage, that's for the 2026 coverage,
Yes. Yes.
and then when it starts,
Okay.
when if they are getting into a Medicare Advantage plan, they are
Okay.
enrolled in a Medicare Advantage plan. they have, if like they put in United, for example,
Okay.
and after they don't feel okay, this is still not, I don't think it's not right for me, something they find a
Okay.
problem with that,
All
they
right.
still have a January 1st to March 31st to change that plan if they are not satisfied in any case.
And which is that a particular plan or just the Advantage plan?
If any plan,
Any?
if they don't, they can switch to
Oh,
another plan.
that's
If
so
they, like an
cool.
agent, like if some people, sometime, the
Like an
customer, they don't,
annulment.
yeah,
Like an
can,
annulment.
yeah, they don't give all the information, and then, like the agent may be enrolled in a different plan that is not absolutely right for them, or
Right.
the, like if they think it's better to look at another plan, they
Okay.
have that time,
Okay.
yeah, to
So
change.
I like that. So
Yeah.
let's say you picked the wrong partner to
Fine.
marry up with, and in December to March, you're like, whoa, this isn't working out. You can get your marriage annulled and choose another
Yeah.
plan.
Like a prenup.
Yes.
Yeah,
Goodness gracious.
that is it. And if they like the plan,
I didn't
they
know
don't want
that.
any changes the next year, they don't have to do anything.
You
They
just,
just leave alone, go.
okay.
Yeah, and if they, when the next enrollment period, if they are thinking, okay, I am going to move, or I don't want to this plan, I want to look into something else, they can do. Otherwise, they can just keep the plan, and the everything is there. They can contact me if they have any problem when I am enrolling somebody for anything. And
Okay.
the problem, they can contact me also, and then I can help navigating through the company.
Oh,
Yeah.
Grace. Yes, I love,
Yes.
I didn't know a lot of these things. Like,
Yeah.
for one, I thought once you chose a plan, that's it. You are stuck with them, like
Mm-mm.
for like the
And
year.
another thing is, like without any time in the life, if you are moving, if you are now here in Hudson, Newport Richie
Okay.
area, and you are moving to Fort Myers,
Okay.
and this plan is not covering your, insurance, then you have 3 months to change your plan to the new plan
Wow.
that is covering in that area.
Oh my goodness gracious. I didn't even know a
Uh-huh.
move would do it.
Yep.
Oh, there's so much to remember. Okay, so if you're
Mm-hmm.
turning 65, you have to remember that. If you're retiring, okay, so if you're turning 65, you have to apply for Medicaid B. And if you're leaving your job after 65, you have to apply within 63 days of leaving your job. And you have to apply for your new insurance plan that you decide to October 7th to December 15th. And then if you choose the wrong, if you find out after January when the coverage does start for the one that you chose, if you don't like it, you have till March 1st. And then if you move, you have to remember to notify them or change your plan because the providers in that area and the coverage in that area is different. So you have to choose again within 90 days. Is that correct?
Yep. Correct. Yeah.
Oh, look at me go,
Yeah.
Gracie. You
Yeah.
are a
I mean, if
wonderful
yeah,
teacher.
if the same plan have a coverage area there, they are fine. They don't have to change anything, but
Perfect.
they have to check. They need to check with their plan directly or with the agent before they like within that 3 month period. 1 month before to 3 month after they move, they should to make sure the coverage is available for them.
Wow. Look at everything I learned.
Yeah.
I knew none of this. You are a great teacher. You're awesome at this. Some people have tried to like explain this to me, and I'm like blah 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 blah.
Yeah.
And like, yeah. So I finally know a lot. Yeah.
Yeah.
Yeah, not enough to sell it or help people out, but
Yeah, selling need, like a selling need more education, and we have to every year we have to certified with the new changes and everything,
wow,
the basics, and not just the health insurance license, but,
wow.
the certification for Medicare is needed
I
to
didn't
sell
know
this.
that.
Yeah,
So I didn't know that you had to be
yeah. The
certified.
agent need to be certified, not only this licensed, they need to be certified annually. Every year they have to renew their certification.
Wow. Okay,
Yep.
look at
Mm-hmm.
you. we're both up to date.
Yeah. Yeah.
This has been fabulous. I'm going to make
Yep.
sure that everything is included in the description for you.
Yeah.
I'm so like tickled pink that we both wore pink and neither one of us knew. So I
Yeah.
love that. I love that.
Yeah.
All right. Well,
And I'm so excited. After a long time, I met you again. I'm so glad I did because, like we could share, some of our life.
yeah, that's the best. That's the best.
Yeah.
One of my favorite things. This is my passion.
Yeah.
This is my passion is showcasing people's greatness
Yeah.
and if it's and sharing great messages, whatever that is,
Yeah.
ideas, old ideas, things that bring people joy or peace or education or help or fun or laughter.
Yeah.
I love this is my passion. So
Yeah.
yeah.
I love you forever. Like when we met first time itself.
Yes.
Yeah. We
Yes.
were, it's how many years? I don't even remember. Maybe almost 15 years,
I think it's
right?
something like that. Yeah. I fell in
Yeah.
love with you right away too.
Yeah. Had a good chemistry that.
Yes, yes, we just knew. We just
Yeah.
all right, I'm giving you a hug and
Yes,
yes,
virtual hug.
yes, yes. And we'll do this again.
Yeah.